Members of the Private Health Facilities Association of Ghana believe that the difficulties private health providers go through in their quest to attract well-trained nurses to work at their facilities is largely impacting negatively on the quality of healthcare delivery across the country. Speaking in Techiman at the launch of the association's annual general conference scheduled to be held in Sunyani in November this year, President of the Brong Ahafo Regional Chapter of the group, Emmanuel Babakwesi, bemoaned the struggles private health facilities go through in getting the services of healthcare professionals.
The major problem in facing private healthcare providers is that we are not getting the health professionals to employ them. That means that we are getting difficult to get staff to employ. But if you look at the number of staff they require from you before they can license you as a health facility, it is really difficult. So what we are saying is that, look, Private Health Facilities Association is not different from Ghana Health Service. It's not different from Christian Health Association of Ghana. But these two, the government gives the health professionals. They post staff to them. Why are we left out? The private man pays tax, yet he doesn't benefit anything from the taxes we pay. So what we are saying is that our members, the members of the Private Health Facilities Association, they are providing health services to what? Ghanaians. And a Ghanaian is a Ghanaian. It doesn't matter whether he goes for healthcare service in the private healthcare sector or he does so at the Ghana Health Service or CHAG. So please, government should look at how he can push staff to our facilities, even if it demands that we contribute, that is from our side of the government side, to pay the remuneration of such professionals.
Mr. Emmanuel Babakwesi believes that a move to post nurses and other health professionals to private health facilities will go a long way to minimize unemployment, breed competition, as well as reduce the recent craze for greener pastures by healthcare professionals.
As we speak, we have a lot of nurses sitting in the house, we have a lot of physician assistants sitting in the house. It's the doctors, I can't say so much. So what we are saying that we can start from somewhere. It's definitely going to be a gradual process. Even if government begins by now to say that, look, we can support you with nurses, even if it is five nurses for every private health facility in the country. I'm sure the nurses we have in the system, even though the majority of them are actually migrating for greener pastures elsewhere, the few ones available, we can still get a small quota. You see, if government begins to post some of them to our places, I can assure you that, look, there will be a time that the competition will be very great, that people will feel motivated and will want to stay in the country and work for their citizens.
They are, however, enthused about the improvement in the reimbursement of NHIA claims by service providers, but call for a review of tariffs to prevent the collapse of some private health facilities.
I want to put on record that again, that there have been significant improvement with regards to the reimbursement of NHIS claims. So we say thumbs up to the CEO, the Chief Executive Officer of the National Health Insurance Authority. Apart from that, one major challenge is still pending, which we believe the scheme is probably working towards it. That is the tariffs. The tariffs are not significant enough. They are not. It's not enough. Because, for instance, as a service, I asked this question somewhere, that a profit-making service provider like myself, I go to the market to buy, let's say, a malaria drug at 5 Ghana cedis. But I'm supposed to dispense it for, let's say, 2 or 3 Ghana cedis. And the big question in this case is, who pays the difference? Is it the provider? Is it the NHIA? Or is the card bearer?
The association, since its establishment, has contributed towards solving major challenges bedeviling the operations of member healthcare providers across the country. Anas Sabit, Joy News, Techiman.